Our story begins with hope. Hope is the name that Faith and her husband have given to their child who is about to be born. It's been a perfect pregnancy, but something happens on the way to the hospital. There's a prolapse of the umbilical cord. Dr. Campbell, what is that?
The cord slips between the baby and the cervical opening so that the cord is compressed, the baby is deprived of oxygen and nutrients.
And here's hope. No movement, no breathing, very weak heartbeat. Now, what does she look like?
She will really be limp, be quite ashen looking, but would be perfectly formed, look like any other newborn.
Another baby. Another
Correct.
baby. Well, the parents, obviously, are waiting. Art, you're the father. Melinda, you're the mother. What do you tell them at this point?
Hope is quite ill. We are supporting her breathing with the aid of the tube in her windpipe, as well as doing the breathing for her. We've given her medications to try and help her heart work more efficiently and establish her body functions.
Do you think they understand what you just said to them?
No.
No.
What I think you're saying is that things are going to be okay. You're just going to do everything. And, you know, we've been trying
For
a long time. You have the technology. I know you do.
Dr. Campbell, deep in your soul, what's your expectation?
That I'm not going to be able to solve it.
They want aggressive treatment. You don't have any difficulty with that, do you?
Not at the start. I mean, I think that you need some time to be able to assess and get a sense of exactly.
Well, that time passes. What you find is severe brain damage, a swollen brain, and a very, very low level of brain waves. The baby is still motionless. So now it's time to talk to the parents again.
How many days old is she first?
Well, let's say a week.
Okay. Hope is now a week old. She's not able on her own to take any spontaneous breaths. Without the ventilator, she's not breathing.
She would not breathe.
She would not breathe.
Without the machine.
Without the machine.
Is she dead?
She's fully dependent on the machine.
This can't be happening.
So
When we came, you said you would do everything.
And we have,
they are trying.
We have
They're
done
doing-
everything. We have her on the most advanced respirators. We're supporting her blood pressure. We're giving her intravenous nutrition. We're treating the seizures.
What are their options, given a baby of this description?
Their options are to continue the level of care that we're providing, which is aggressive, maximal care. In terms of withdrawing care or withholding care, I think we would still need a little bit more information to be able to definitively say the true level of brain functioning.
All right, you've had your time. The baby is not changing in any material way. So one of their options, if I heard it correctly, is to take the baby off the ventilator.
Correct.
It's not an option.
it's not an option.
It's
Our
not an
baby's
option.
not dead.
It's not an option in our faith. It's not an option from my personal point of view. It's just not an option.
I have a suggestion for you. Dr. Rogers took care of you during the pregnancy.
That was a good doctor.
Do you want to talk to Dr. Rogers about this situation?
We trust our doctors, but we hear these terrible reports. We don't know. Does she have brain function at all? All these technical terms. What do you suggest we do to help get the information we need about her future?
I think that some of the answers you want, we actually can't provide. We don't know exactly what the baby's long-term outlook will be, although everything I'm hearing from Dr. Campbell suggests to me that it's going to be very bleak, potentially, the baby's outlook.
Since this all started, I go home, I get on the internet, I see people say that babies get better, that doctors aren't always right.
Yes.
Dr. Rogers, why is shutting the ventilator down even suggested as an option?
It's suggested as an option because this baby is very unlikely to, first of all, ever get off a respirator.
That would be okay. We could do that.
Yes, and I think that that is an option, quite frankly. But I think it's important to understand what life for this baby chronically on a respirator is potentially going to be like. It isn't that the baby will be on a respirator and life will go on. The baby will develop pneumonias. The baby will potentially develop any number of other complications, not the least of which is we have to make decisions about how to feed the baby.
But if the baby's not on the respirator,
yes,
what are the options?
the baby will
The
die.
baby dies.
There is no question. The baby will die.
But that's not an option.
I think given where you are right now and given your beliefs, the baby will remain on the respirator.
Dr. Brookhoff?
I can't tell you what's going to happen to your baby. Only God can predict the future. What I bring to the table is I know what's happened to other babies I've treated in this situation. That's what doctors bring, is we bring our experience and the fact that we want to promote their life. What I think from having seen babies like this is that they don't live a very long time despite all of our efforts because of the pneumonias, because of being on a ventilator. At the same time, I owe it to you to give you the options. I don't know if this baby's going to survive. I don't know, and if I had to guess, I'm worried that the baby might not survive. The only I owe it to you to tell you that.
I can't kill my baby.
Well,
I
you
can't unplug
exactly.
a respirator.
Let me
Is my
unburden you.
baby dying?
Let me
am
unburden-
I just helping my baby to die, or am I actively killing my
No.
baby?
And we're not asking you
the
to
decision
to
of
make
life and
that
death
decision.
is not yours or mine.
But
it's
it
not,
is mine if we decide to pull the plug
I'm
on
not.
the
I'm not
respirator.
telling you to pull the plug. I'm saying if the baby, to be honest, if the baby is dying, the baby is dying.
But
and
is the baby dying?
I think she is. She shows no neurological response and shows so much brain damage. I don't think things will be sustained.
Father
but
Parris,
I don't know.
why is turning off the ventilator even an option here?
I've known the Kaplans a long time. I performed their wedding. They've been in my parish. They're good Catholics. We have great emphasis on the sanctity of life, and people think this requires that we do everything possible to sustain every life. But that's never been the Catholic teaching. We understand that God creates us, that we're created for the purpose of living this life and ultimately going back to God. And that decision is God's, not ours to make. It can be at 80 years, it can be at 8 days. And the Catholic tradition in this, and I've talked with both of the parents about this, is that if medicine holds out no realistic expectation that the child will improve, then there's no obligation to use it. And the cause of death is the underlying disease that's created this problem, not the removal of the ventilator. So this isn't killing, this is letting die.
But I don't want to stop. I don't
Even
want to
though
give up.
Father says all that's happening is you're allowing her to die as God might have.
I'll never allow her to die.
Ken Connor?
Well, I think it is a very important distinction morally for the mother and dad as to whether or not they're going to take active steps to cause the death of their child or whether or not they're simply going to let their child die.
I take it you think that shutting that ventilator down is an active step.
This baby would die, obviously, without the benefit of the ventilator, which means arguably she would die from an underlying medical condition. I don't think that's the same as actively taking her life if the parents decide. I think it's a very difficult decision. I would have less apprehension about removing the ventilator than I would say depriving the baby of food and fluids, in which case she would die arguably from dehydration or malnutrition before she would die of her underlying condition. But
Marcia Angel?
Well, you know, we haven't been talking about the baby as much as we should have. And that's what I would like to get to. I do think that the parents have the right to make this very difficult decision. I would not stampede them into doing it in the first week or the first 2 weeks even. I would let them live with it for a while. But what I would try to get them to understand is that there is no higher brain function here. This baby, fast forward months, years, decades, this baby, even if it could be kept alive that long, would have no feelings, no awareness, none of the things we associate with being a human being. I would try to make them understand what it's like from the baby's point of view, which is nothing. There is nothing in this baby.
So
But that will take
in
time.
the best interests of Hope.
Hope has no best interests at this point. No higher brain function means no best interest.
How
The
can
parents.
you say that about a baby? How can you say that about our baby?
That
Our
is
baby
what
does
I
have
would
a
wait
best
to say to
interest.
you. I would say that to the doctors maybe. I would say that to Arthur Miller. I would not say that to you just yet.
But why would you not say it to me? I am the parent. My baby does have a best interest. My baby has a right to life. My baby has equal protection under the law. All those things that babies have, whether I believe my baby has it or not, whether there's a higher brain function or not, unless you can tell me my baby is dying.
And you know, Doc, medicine changes, things improve. Someday
That's
they
true.
might find something.
That's true. As I said, this is your choice. This is ultimately your choice. And I would have the doctors and the hospital do what you wanted to do. But I would let you know that the things that we associate with being human, the capacity to form attachments, to love, to feel, to think, even if it isn't Albert Einstein thinking, that this will never happen to a child with no higher brain function.